So it's 4 in the morning and I'm just getting back from the hospital. I was called in tonight to do a trauma, and we had to do a trauma laparotomy. Probably one of my most favorite operations. I'm gonna put a link in the video here so you take a look at a breakdown I did recently on the trauma laparotomy and why I call it the king of operations. But the reason why I'm picking up my camera right now at 4 in the morning to do this little introduction is because I recently recorded a video. It's a reaction to med school insiders, the worst lifestyle specialty. And what better time to think about lifestyle than at 4 in the morning when you're tired after operating. But I will give you a little hint. There's so much more to what makes a lifestyle specialty a good lifestyle than just money and time. So let's check it out.
Hi, my name is Dr. Rich Hills and you're watching my channel, Knife Skills. Today, I want to break down a video that I've seen on YouTube, which is Med School Insiders, the worst lifestyle specialties. Now, I've been privileged. I've had the opportunity to practice in at least 2 of these lifestyle specialties. I've been a family doctor, practicing primary care, and I'm a trauma surgeon and a general surgeon, oftentimes considered some of the worst lifestyle specialties. So let's dive into it and see what he has to say about my beloved specialty.
Dr. Jubal, MedSchoolInsiders.com. To answer which specialties have the worst lifestyle, we first have to ask what makes for a good lifestyle. The general consensus is that it comes down to 3 primary factors. First, the hours you work, meaning the predictability and total number per week. Second, the amount of money you make relative to the amount of work put in. And third, the quality or substance of your work.
So I think the quality of the lifestyle you have is so subjective. Every single person has their own set of values. And definitely some specialties are going to align with that. If you're someone who's focused on getting the best compensation for the number of hours that you work, you're going to be drawn to a very specific type of job. And you're going to find a job that maybe has longer hours or maybe the compensation isn't as strong to be a terrible lifestyle. On the other hand, most of us recognize that a huge part of our adult life is spent working. And a lot of times we want to become doctors. One of our motivations to become doctors is to have a job that inspires us on a day-to-day basis. Even though there's no such thing as a perfect job, there's always negatives. We want a job that at the end of the day, we're excited to get up and perform in the morning. And oftentimes that matters more than money. And I would say that is probably the attitude of most people who are interested in medicine. And certainly I would hope that if you're considering a career in medicine, you're watching this channel, that's important to you. You're thinking about things beyond those financial compensation. As far as the quality of the work is concerned, I think that's cornerstone. But how you define quality of work will depend on you. And I think that's one of the most important things. You'll find your passion in medicine, and that will be ultimately the best lifestyle for you.
So why would someone choose a specialty with a difficult lifestyle? The biggest factor is simply falling in love with the field. If you love excitement, unpredictability, saving lives, and the operating room, you would love trauma surgery, and the challenging lifestyle would be very worthwhile. Another theory I've heard thrown around is that those who choose more challenging lifestyle specialties are workaholics at heart, and may prefer a challenging and demanding work-life balance. They'll even brag about how bad their schedule is. Workaholism is a common coping mechanism, as it's easier to ignore one's inner demons when you're working and don't have time to think about them. The relative appeal of a specialty's lifestyle is also highly subjective.
So this issue of being a workaholic, I think, is important. There are workaholics in medicine in every specialty, whether it's a lifestyle specialty or not. I think painting people who choose a challenging specialty as a workaholic definitely is painting people all with the same brush. And we all understand that everyone has different set of values and different things that they're interested in and bring different things to the table. I would say that another way to characterize some of the specialties that are described here as, instead of difficult lifestyle specialties, just as challenging specialties. Do you want to be challenged on a day-to-day basis? Because if you are, that would fit a lot of the criteria here for a difficult or bad lifestyle specialty. Another thing that frustrates me a little bit about these types of videos, it's the issue of specialty training as kind of a menu. Like you're going to a restaurant and you're like, oh, I want, this appetizer and this main course, and, I want my career to look this way. The reality is that your career in medicine is hardly a menu. It's truly something that should draw you into it. So again, looking at specialties from these perspectives and saying, well, I want my lifestyle to look this way and I want my life to be like that, really misunderstands what it's like to get out there and practice medicine as a doctor. The happiest doctors that I know are people who really feel that this is where they belong at the end of the day.
Neurosurgeons have some of the most challenging hours in the hospital, but they also have the highest compensation, which is why we joke that they make the most money but have no time to spend any of it.
Which isn't a coincidence. If you're working many, many hours in all fields of medicine, you're going to have an opportunity to earn more income. So it does go hand in hand. You do have some control over this factor.
With that being said, know that this isn't a list of absolute truths, but rather a subjective list of stereotypes for which there are many exceptions. Let's have fun with this list and not take things too seriously. And remember, there are always exceptions to any generalization. If you want a challenging lifestyle, you should check out general surgery. The running joke amongst medical students is that you go into general surgery if you're either a masochist or couldn't get into any more desirable surgical specialty.
Am I a masochist?
This is obviously not the case, and general surgery is a fantastic field with lots to love. But the reason medical students joke about this is fourfold. First, general surgeons work very challenging, unpredictable, and often long hours. Second, they're often dealing with pathologies and body parts that some would consider less appealing compared to other surgical specialties, like the intestines and its associated smells and fluids. Third, they make less money than other surgical specialists. And fourth, it's the least competitive surgical specialty to match into for residency.
One of the issues about general surgery being less competitive than other specialties really comes down to a few things. One, general surgery is oftentimes a gateway specialty to other specialties. You might choose thoracic surgery, cardiothoracic, trauma surgery, plastic surgery. Many other opportunities will come out of a previous general surgery training, depending on where you do your residency. In addition, general surgery is required for any hospital that has an emergency department. You need the support of a surgeon to have a proper emergency department. The reason why is that many conditions that present to an emergency department are in fact surgical, and general surgeons are the ones that oftentimes deal with those surgical emergencies. So as a result, there are actually many more spots available for general surgeons because there's just so much demand for a job in that field. And many people may choose general surgery because they want to have some job security, recognizing that there'll be opportunities to do general surgery in just about any community after you graduate.
General surgery used to be more, well, general, dealing with a wide variety of pathologies. In rural settings, this is still certainly the case, as there are few surgical specialists nearby. But as the field of medicine moves further towards greater specialization, general surgeons primarily deal with gastrointestinal and endocrine pathologies. If you want to work on the heart, you'll need to specialize as a cardiothoracic surgeon. To work on bones, orthopedic surgery. For complex soft tissue reconstruction or aesthetics, plastic surgery, and so on. But general surgery remains the default path for the medical student pursuing surgery, but who isn't quite sure what kind of surgery to pursue. After general surgery, you have a wide variety of options for fellowship. For example, after general surgery residency, you could pursue specialized cardiothoracic or plastic surgery training, but note that this will require a few more years of training versus matching into a dedicated CT or plastics residency immediately after medical school. With the general surgery tract, the main drawback is the increased length of training. The main benefits are that you have more time to make a decision prior to committing to a subspecialization, and it's also a far less competitive path. In fact, many CT or plastic surgery applicants, when applying to residency, will apply to general surgery residency as a backup just in case they don't match. Next up is primary care. That's right, primary care has one of the worst lifestyles, and you're probably scratching your head in disbelief. Allow me to explain. You can become a primary care physician through various avenues, such as family medicine or internal medicine, amongst others. Most wouldn't consider primary care doctors to have a challenging lifestyle, since you'll generally be working regular office hours, roughly 40 hours per week. But that's only one component of a specialty's lifestyle. There are 3 other components that translate to primary care having a poor lifestyle. First, as a primary care physician, you'll have lower compensation than most any other specialist, averaging roughly $240,000 per year. That's not bad, but the average specialist makes, on average, $350,000 per year in comparison. If $240K sounds like more than you'd ever need, come back to me in 10 years when you have student loans to pay off, a mortgage, family, car payments, and retirement to save for.
Now remember, a lot of this is about that trade-off of time and money. We've said in this video before that specialists oftentimes are working more hours. If you think about the neurosurgeons who are the best paid in the hospital, they work the longest hours. If you're going to choose a specialty where you're typically only working 40 hours a week, when I practiced family medicine, I didn't have to do any call at night, I didn't have to do weekends, then of course your average income is going to be lower. There's oftentimes people are going to choose to go into family medicine for that stability in time, the predictability. They can invest more into their own personal families, more time into their hobbies. Maybe they have other pursuits, entrepreneurial pursuits outside of primary care. And that flexibility is worth the financial trade-off. In medicine, there's opportunities to always work more. And so when you use these average numbers, it's very difficult for you to get a sense as to what your life would be like choosing that field. I have friends of mine who are in family medicine and earn more than I do as a surgical specialist because they've focused on certain areas that are well compensated and work very hard themselves.
Second, the amount of charting and paperwork in primary care is abnormally high, in some surveys averaging over 18 hours per week. In comparison, ophthalmology and anesthesiology are close to half that.
Paperwork is huge in family medicine. You have to follow up on referrals that you've sent out. You oftentimes have to review results that maybe other specialists have ordered. You have insurance paperwork. There are notes to the patient's employers. There's so many different things you'd have to deal with as a family doctor. But part of that is the joy. You're taking care of the patient in a comprehensive way. And that paperwork is part of patient care. And you can learn to love it just as you love other aspects of your specialty.
And third, scope creep issues primarily affect primary care physicians, although anesthesiologists have also been subject to difficulties. My mentor in medical school, who was an internal medicine primary care physician, advised me and his other students that while medicine is a fantastic profession, he finds the changes in primary care quite disconcerting. He pointed to these three issues of reductions in reimbursement, increases in charting, and mid-level scope creep as primary concerns. OB-GYN is an often misunderstood field, and most in medicine would warn you about its terrible lifestyle implications. Some obstetricians and gynecologists have extremely challenging lifestyles, and it doesn't help that their residencies have a reputation of being more malignant than average. It's often a dreaded rotation by many third-year medical students.
I think why it's dreaded is not because it's malignant per se, and obviously every program has their own cultural challenges. Certainly general surgery at times has had a reputation for being maybe less than a positive rotation. But I think a lot of people actually aren't seriously considering obstetrics and gynecology. A lot of people rule it out very early, and as a result, they can't be as excited during that rotation. If you're not really seriously considering something, you're not going to really be that thrilled about doing it. I knew that I was going to be doing family medicine as part of my career, and obstetrics is going to be part of that, and taking care of well women is going to be part of that. And so I had actually a fantastic rotation. One of my favorite rotations in OB-GYN was reproductive endocrinology, a fantastic lifestyle specialty with much office procedures and much office work and very little in the way of call or those types of responsibilities. The patients were excited about the opportunity and the help that you can provide them. So there's just a lot to love when it comes to obstetrics and gynecology that might not be appreciated. And again, I think a lot of people rule it out early, which is totally fine, but then don't give their experiences on the rotation enough credit.
As an attending, your lifestyle will be highly variable depending on your practice type. It used to be the case that obstetrics was extremely challenging since babies don't care about your sleep schedule and you would have to rush to labor and delivery on a moment's notice. But in recent years, OB has moved more towards the shift work model, a welcome change in most people's eyes. Gynecologists, on the other hand, could have a great lifestyle if they wanted to focus on primarily a clinic-based practice. It's no surprise that surgical specialties have challenging lifestyles, but not all surgical specialties are created equal. Trauma surgery gets a bad rap since traumas are unpredictable and can come in at any moment, seemingly at the most inopportune hours of the night. Many trauma surgeons have shift work schedules, particularly at larger and more established institutions. It's not like you're relaxing on your day off and you suddenly get called in. You're either on or off service, but still the hours can be long and challenging. But others at smaller groups may have to manage their own patients in-house and aren't able to rely on more predictable shift work schedules. Vascular surgery also comes with a particularly challenging lifestyle. You're specialized enough that you're covering a large catchment area, meaning there will be emergencies happening just about every night that require intervention. And unlike other specialties, where you act as a consulting service and hand the patient off for management to the primary team, as a vascular surgeon, you will be rounding and managing your own patients. Neurosurgery is similar to vascular surgery in that regard, with the added complexity and burden of dealing with very sick patients with often poor outcomes. When you think about the types of patients that require brain surgery, you realize how many outcomes aren't as rosy compared to some other surgical subspecialties. That was a surprisingly large factor that actually pushed me away from the field. Neurosurgeons are widely known for working the craziest hours in the hospital, but they're also the highest paid specialists. The ceiling for any given specialty is limitless, meaning you could always work more hours. Many of my friends and colleagues from medical school are now attending physicians, even in supposedly great lifestyle specialties. But because they're young, hungry, and want to set up a strong foundation for their future professional and financial lives, they're willing to grind extra hard for a year or two before dialing their hours back.
So this is so important. Doctors have this opportunity to always work more. And so that trade-off between time and money is always present. So your values are going to dictate your lifestyle in a lot of ways. If you want the challenge of taking care of sick patients that are going to arrive at hospital at unusual hours in the night, you're going to be invigorated by that type of practice and be excited about that type of lifestyle. On the other hand, you might be focusing and be more interested in an office-based practice. But in either way, you can always book more patients, work more hours. You can always take more call shifts. There's always more opportunities to work more if you want to trade off those financial benefits. And I do think that people who are young, when they're starting their practice, are a lot more likely to make those trade-offs because they want to establish themselves, prove their mettle, prove that they can contribute to the community. They want to maybe strengthen their skills while they have the energy to take on more patients. And they may actually want to pay off loans quickly and put themselves on an excellent financial footing. This idea of delayed gratification. They'll enjoy their time off more as they become more and more established. So in many ways, the lifestyle is one of your own choosing.
Shift work is another arrangement that is more common in something like emergency medicine. With shift work, it's easier to dial your hours down or up, depending on your desired work-life balance. With surgery, shift work is less common, and you'll often have to stay late if there are intraoperative complications. It's very rare for surgeons to work fewer than 60 hours until later on in their career. Although within surgery, there are some that are more conducive to clinic, allowing for reduced weekly commitments, like urology. If you want to learn more, we covered this in So You Want to Be a Urologist. Lifestyle should not be your primary consideration when choosing a specialty, but it is important. In fact, I would say most in their early to mid-20s underestimate its importance.
Lifestyle definitely shouldn't be your primary reason for choosing a particular specialty. And if it is, it's something that I would encourage you to listen to, maybe reconsider why you're going into a particular specialty. Remember, the specialty that you end up in will oftentimes be a calling. It'll be something that will draw you in. I encourage you as a medical student to spend as much time working with the doctors who actually practice in that field and really get a sense of what it feels like to work with them. If you're excited about a certain type of patient pathology, you're excited about being in the operating room and having that impact on a patient's life, then you're going to be drawn to that type of field. And I would let yourself be malleable and flexible to how you feel. That's extremely important. At the end of the day, this is your career. Much of your life will be spent focusing and developing those specific skills. So I want to encourage you to let the specialty infect you and inspire you. That's my thoughts on the lifestyle specialties. If you have any comments or any other videos you'd like me to react to, please list them below. I also appreciate any likes or subscribes. It helps me and motivates me to continue to create this content. It's always a pleasure to get in front of the camera and speak to you directly. My name is Dr. Rich Hillsden. You've been watching my channel, Knife Skills. Have a great day.